As a child, I grew up where you had mumps, and well, I heard of measles, and as staff nurse we just spoke about the poliomyelitis, and so you were able, you had it. You see, there were evidence of this disease affecting us and the way it affected our people, and so over the years you have seen, if not total eradication, significant reduction in those diseases, and so that is what stands out for me, and the work that was put into getting us to this high level of immunization by nurses and doctors.
I am also in agreement with that, and I want to just simply add to see, not only as Sister would have mentioned the work that was put in, but the work that has been maintained, because that is key. Even if you implement something, like in this case, you have vaccines, we know that vaccines save lives, we know there are some side effects, we know what their intended actions, but if you implement a vaccine and persons don't let me say quote unquote buy into it, then you would have a fall in the amount of persons being protected. But the fact that throughout the Caribbean, based on our knowledge, that we have been able to maintain such a high level of immunization, it means that we have a healthier population regionally, and that's a plus for us.
Some of the major standpoints for me is the fact that the Caribbean was one of the first regions to be issued by PAHO and WHO, I think is in 1994, about that we've eradicated polio. We've also in 2015 to 2016 documented the elimination of endemic measles and rubella and those things. One of their major standpoints is the introduction of EPI in 1977, where that ensures wider coverage of vaccines, wider spread of vaccines, as well as the continued introduction of vaccines, because over the years we've had the pneumococcal vaccines, we've had the HPV vaccines, and we're continuing to introduce new vaccines in our system.